T-DXd. The incidence is 10 to 15%, but the key is if a patient is having any symptoms, they should let the provider know.
We talk about real-world decision-making. These are all, of course, shared decisions when we're talking with patients. What are the benefits and risks that you plan to discuss with patients?
Absolutely. With any therapy, we talk about efficacy, and then we talk about the toxicity profile as well. We reviewed the efficacy in terms of toxicity profile with T-DXd. When I talk to a patient that I'm going to start T-DXd, I review the side effects. I start with nausea. That's the number one side effect with T-DXd. And when I talk about any side effect, I also talk about supportive therapy or how to manage or prevent that. And we can come back to the specific management of these AEs. The second one is some degree of myelosuppression. So I tell them that we'll be monitoring toxicity with blood work. The third is some degree of diarrhea. And I tell them that if they have this side effect, there are medications that we can provide. And then finally, I do warn patient about the serious, rare but serious side effect of pneumonitis with T-DXd. The incidence is 10 to 15%, but the key is if a patient is having any symptoms, they should let the provider know. Because for symptomatic pneumonitis, if that progresses, that could be very dangerous.
Certainly. And I think, with all of us having longer experience using T-DXd in later line settings, et cetera, we are more comfortable with the monitoring, and we can address that shortly. It does seem to me that for most patient interactions, that sort of efficacy, especially in the first line, is going to be so important. And so generally this sort of risk-benefits discussion sways heavily towards what is going to get you the longest survival. And I think you're right, side effects can be managed, especially prophylactically or ahead of time. And there was really fascinating PROs data presented at the rapid fire session that you moderated for DB09, suggesting that, at least for patient report, there was no difference in PROs for, THP versus continuing T-DXd plus P,
Absolutely. Yeah. And often, PROs are complex because if a patient is having symptoms because of the disease, if you control the disease, then that would help reduce that symptom and could improve quality of life. But then you can also have side effects from drugs which can impact PROs. And so the key then becomes management of those side effects.
And balancing that.
One of the things to consider with PROs, and that was discussed in the session also, is sometimes in clinical trials, they're just measured at the start of a cycles. They might not fully capture what a patient is feeling in between cycles. So we just need better metrics for measuring that as well.
That's certainly an ongoing need in the field.